Okay, are you ready now, Kamal? So this class is continuation from your previous session where I have explained you some techniques for the reading, that what is reading in OET, how many sections are there, how many questions are there, how many question types are there. Then I taught you some reading skills like skimming, scanning and intensive reading. After the class, I gave you the test where you have done some mistakes. And first, I will explain you how to rectify those mistakes. Okay. So when you will know that this is what I have done was wrong, you can perform better in the next test. So this is the test I gave you. Let us first talk about part A, where I have given you this C, this test 4. Okay. So what you were supposed to do is before even reading the question paper, okay, that was your question paper for part A. You know that your part A has three types of questions. One is matching, one is finding the words, that is scanning, and one is short question answers. So you already knew what type of questions you are expecting, but before reading the questions, for skimming, you need to read the passage first and not to read overall, just to skim it. Skimming is reading like a newspaper. So what you are going to do on this paper is, let's say if you are taking this test, you just try to read the title. It will give you an idea that what is this section about. So with the title itself, you can understand that this is about assessing, right? So you are just highlighting it and keeping the things in mind that this is about assessing a diabetic. Next one is talking about applying dressing. So this is about something related to dresses. So with the title itself, you get an idea. Then you go to the next. You don't need to waste a lot of your time on this. And then you go to your text C. It is telling you something about debridement of DFUs. And then if you go to D, it is telling about the dressing, benefits and drawbacks, advantages and disadvantages. That's it. So you just got an overview with the help of title itself. Now, no need to read it thoroughly. Just look at some keywords that are written here. You see, it's every word will give you an idea of it's about assessing. Next is about dressing. Next is about the debridement. Next is about advantages and disadvantages. So now you will directly go to the questions. That's it. This is how you will skim. No need to read a lot. Only first or last sentence, if you want to read, you can read. Now you read the questions, and your first two questions both were wrong. Your third question was right. So in the first question, when they said how often to change a dressing, so something related to dressing. You look at the title. The title itself is telling you something about dressing, right? Are you with me, Kamal? So you look at the title, what it says.
Addressing.
So
Applying dress.
it seems like your answer should be somewhere in this section. Just to confirm, you look at the question again. They said how often. So what's the meaning of how often? It means your answer should be the number of days or time, right? Now you will search whether this information provides any information about how often. So you see this text, change the dressing daily. Isn't it answering you the question of how often? Y-
Ah,
Yes, yes or no? It's about the dressing and it's also telling you how often. So it should be daily. Now you said the answer is B. Now you said the answer is D. Okay, let me take you here. They did not mention anything about dressing in, okay, there is some information about dressing here in text D also, but did they mention how often? That was your answer. I'm just checking
no.
your answer first. You said the answer is D, that because you have seen the word dressing here. It means you became too quick to decide the answer without reading the complete question. So what's your first mistake? That you don't understand the question completely. You are just matching words to words, that you have seen a word dressing here and you have seen a word dressing there, and you simply matched it with D without checking that is there anything about how often. Okay, now I'll tell you how to rectify your mistakes. Let's say you said D is the right answer, but actually it was not D, it was B. Now, how to rectify it? How to analyze? D is wrong, that's for sure. Now you won't go to D again, because if you will go to D again, because that was your first understanding about this question, you will again see the word dressing and you will again feel like my answer is D. This is wrong. There is no debate. Now you won't go to D. You will go to B and ask yourself how B can be the right answer. And try to find the information in B rather than to search why I am wrong in D. Search how B is the right answer. So in this way, you will be able to understand your mistake. So you will know that yes, my mistake is I matched word of dressing to dressing, but I did not notice about my question key, another question keyword that was about how often. Clear? Now next question also was wrong. Let me check first your answer sheet. The second question you said answer is C. No, you said answer is B, but actually the answer is C. So now B, your answer is wrong. You won't go to B again to know how this is wrong, but you will go to C, that how C can be the answer. Can you read the question for me?
Understand the consequence of tissue removal.
So what's the meaning of consequences? Ensuring patients, it means you need to ensure the patients to understand the consequence. What is the consequence? What can be the risk to the patient, right? Usually when we are telling about, when you are telling something to a patient, you tell a consequence. So what does it mean by you are telling a consequence? That you are telling the risks related to it. Next is about tissue removal. So you are telling the patient about the risks about tissue removal. Is that right? So instead of wasting your time on reading the passage over and over, you need to focus on your question more. You see, I'm spending more time on the question rather than the text. Understanding the question is half answer. If you understand what is needed, it's easy to go and check. Now we will go to C, that is the right answer. So you will go to C and search how C can be the right answer. When they said about tissue removal things, you should know it's something about debridements. It should be something about debridement. So you see, it's about removal. You see, it's written several times, but we don't rely on words. Okay, debridement should remove, and again you see the word tissue. So the question was that ensuring patients, that you should ensure the patients that the patient should understand the consequence. So what is the consequence? So practitioners must explain fully to patients the risks. So risk is what? The synonym of consequence, right? Risks and benefits of debridement, because you are getting an informed consent. So you need to inform the patient about its consequence. So this is given in C. This is how C is the right answer. You understood how to rectify your mistakes now? I will repeat. I said when you are reading text, when you are on text A, on your first part A, then what you need to do is just look at the title. Sometimes your answer is hidden in the title itself. So you read the title, it will give you an overall idea that this passage is about what. Then if you read all the titles, you will get an idea that this type of question might be given in this. So when you're reading the question, don't merely match words to words. You can see some other keywords also. So you can look for the question keyword. For example, how often are ensuring. Likewise, the next question about reasons. So you will find the word causes, reasons, factors. Okay, then you will go to the passage and you will see how that particular option can be right. This is how you will rectify your mistakes in part A. Is that clear to you? Remaining, wherever you have wrong, you try to do the same way, the way we have done just now, these two. Rectify the other questions as well. Okay? Okay, Kamal, can I proceed?
Yeah.
Now I'm proceeding to, I'll try one question for B and C as well. Okay, because you have more answers wrong here. So you can see how to approach this on a practical paper. I told you yesterday we will try this on actual paper so you can understand how to read the passage, how to highlight the question keywords, etc. And I have used the same paper that I have given you as homework. Now you see the question. I said you for this one you need to read the questions first before reading the passage so you can know what is my focus on the question. Right? But here the first step, let me tell you step by step. Read the title. It will give you the idea what is the text about. This is your step one. So you understand that this is an extract from a manual on surgery. That's it. Now don't read anything after that. Step two is read the question now. Okay, step two is read the question now. When disclosing distressing information to patients, this is your step two. Staff must avoid. So it means you should avoid what? Now see what is the differences between options. Sometimes even I don't read the options first because sometimes there are traps, there are distractors that you see a word matching. For example, you have also selected B because you have seen the word family here and you have seen the word family here and you matched it. So sometimes I don't even read the options, I just read the questions first. Anyway, you are reading the options and you will check what is the difference between the option. So the question is, what should staff must avoid? That is your question. What should staff must avoid? You understand the question first. Okay. Should they avoid temptation to use simplistic language? So you're
Okay.
focusing on language. Directing their attention at family members, another keyword, and then any approach that which leads to misunderstanding. So these three words are very clear, different from one to each others. So this is your step three, that you read the title, then read the question and underline the question keyword, look at the options and see what is the difference between options. Now you will go to the passage and you will focus on what should staff must avoid. So the delivery of bad news is very difficult. So this is same information like you're disclosing some distress information to a patient. This is the same sentence here. Arrange to talk to the patient, but it's not about what you should avoid in the company of family. So you see, they are not talking about avoiding anything. Only words are matching, right? So that cannot be our answer if we see this one, because this is what you have selected. Okay. Now next one is, one minute. Now, next is you keep on reading. In some cultures, it is not common to give difficult news directly to the patient, but we are not talking about cultures. We are not talking about what is common. And we must be aware that the norm and customs of our patients may not match our own, right? We often we try soften to deliver delivery of bad news by saying too much confusing that matter, or you never decide reading by half, or by saying too little and leaving people with unanswered questions. Okay, there is some information about simplest language as well. Hmm? Don't say, can you read till here? Hmm?
Must must avoid means leaving the peoples with unanswered questions, means confusion, unanswered questions. This word is matched with misunderstanding.
This is
So I
what,
continue.
okay, yes, this is what we often try, right? This is about, it's not we must, you focus on the word must not, right? We must avoid. So it's only about often we try to soften this or that. It's continuation of the previous one, or by saying this. So they said, if you read next, then they said what you mean and what you will be, that what will be understood is cancer. Be clear. Be clear, allow people to understand and feel of some impact of that news, and then allow them to question, allow them to ask questions. So what does it mean? Hmm?
They're not misunderstanding.
So if you focus, yes, there is some information about family, but it's not about directing their attention to family. There is some information about simplest language as well, but this is what they said. We often try, but the question is what we should avoid. We should avoid, we should be clear, we should not make any misunderstandings or any approach that leads to misunderstanding. They should be clear. They clearly said, be clear. So, be clear means that any approaches, you should avoid any approaches which leads to misunderstanding. Allow people to understand. Even allow people to understand is also giving you the sign of something related to understanding, that they should feel. It means what? They should not misunderstand anything. They should feel the impact of the news. Otherwise, what will happen? They will get a misunderstanding of it. And allow them to ask questions. So what does it mean? That if you are giving misunderstanding, they are not clear about the things, they cannot ask questions about the things. And then again they said it is often necessary. You should even focus on these words. You say must and often and often. So it's not, it's must. It's often necessary to repeat the information to other family members. Again, you see, this is a distractor, that you see some information related to family members again. That is why maybe you have selected this, because you see the family members written twice in the passage, or maybe thrice in the passage. So what do you understand that in multiple choice questions there are traps? And what is that trap or distractor? That you will see exactly the same word written in the text and written in the question, but that is not the answer. The right answer will be given only by understanding the text, not matching words to words. This is called intensive reading. It's neither scanning, it's not skimming. We don't scan only the information to find out the words. So if you will match, it will become scanning. If you will just skim and won't understand the meaning, you will not be able to find the exact answer. And if you will not read it carefully, so it requires intensive reading. The third skill I said you. So in intensive reading, you remember I said you small words will change the meaning. Even the word a and an, you look something singular and something plural in the text. So in intensive reading, you focus on the must and often are different words. Okay? Is that clear to you? So this is
Yes,
how
ma'am.
to rectify your mistake. Whatever is wrong is wrong. Let's say you said answer B is right. Now B is wrong. So it means you don't focus on how family member cannot be the answer. Forget about it and try to check when the answer key said the answer is C, that means it's C only. Now you try to find out how C can be the answer and try to match the information with. Then only you will understand. Okay? So should I proceed to the next? Nothing to you. So now I'm going to the next section, section C, where you again you have multiple choice questions. In this one, how to approach it, read the title, and then if are any subtitles are given, then you can look for it. It will only give you an idea what is the text about. You can only quickly skim it, or even you can directly reach to the questions. Okay? Yes.
Okay.
Okay, now for question number 7, you are wrong on question number 8, but let me explain you 7 also. So in question number 7, what you are supposed to do is that you read the question before the passage. In the first paragraph. Can you read the question for me?
In the first paragraph, what aspect of diabetic 1 is highlighted? The options are
Mhm.
demanding treatment which it entails, the extent of the problems it causes society, the degree of disruption it brings to patients' lives, the severity of medical complication it can lead to.
Okay, so I'm just highlighting the words, question keywords. Okay, so like this, you are highlighting the question keywords. That what's the difference between the options? Okay, just give me a moment. All right, so you read the question and then you have underlined the question keyword, and it's even easy that you need to just go to the first paragraph. They said, what aspect of DMI is highlighted? So your focus is on highlighting of something. So you have gone back to the passage, you have seen your keywords that this is a chronic condition. You're highlighting again the question keywords and a significant um, public health problem. These words, okay, later I will give you the list of vocabulary also, like the word significant. You remember I told you there are some nouns, there are some adjectives, there are some adverbs that gives you a signal of my answer is nearby. So they are talking about complications. Okay, they're talking about premature mortality. Then they're talking about diabetes. Then they said about insulin. It is also matching with some of the words, but not exactly. And then psychological changes may force, now there is a strong language given, may force patient to face complicated challenges. And then it will reach how to read like a newspaper. You're skimming it and underlining whatever keyword you got. So what you have done, you read the question, then you came to the passage, and then you have skim it like a newspaper. You read some words, ignore some words, and try to get overall meaning of this. So all these options, if you go back and look at the options that you have already highlighted for you. Okay, so you can see it's talking about what? Disruptions, right? It's talking about disruptions it brings to patient's life. Some information about treatment, that insulin is written there, but it didn't say anything about the problems it may causes society. And there is one word complication also written there, but it's not, it can lead to what? The main highlighted part was disruption that is given to disruption that is given to patients' lives. Okay, that's why they have used all these keywords that are matching. Disruption. Okay, now the second one, this was by the way right that you have written, but your next answer is wrong. So let's focus on the next question that is going for you, question number 8. Okay, now that was the question. Can you again read the question for me and tell me what are the highlighted words here? Hmm.
Psychosocial approach.
So your keyword is benefit. Like in the previous one, the word advantage and benefit was there. The writer sees one benefit, so your focus is on benefit. Benefit of what?
Benefits, advantage or benefits.
Hmm. Hmm. Yes, please tell me your keywords in the question. Benefit and
Benefits, biopsychosocial. So
so
the
you will
keyword
underline.
is
Yeah, so you will underline benefit
yes,
and biopsychosocial, and then in the
are
options,
the
what what is
valuable
your
resources.
okay? So what are your keywords in the options?
Research,
Yes, allowing medical professionals to conduct valuable research. So, are they talking about, you need to check whether they are talking about allowing medical professionals to conduct any kind of research? Okay. For the research, the other words can be, the synonyms can be experiment. Okay. Can you note the words with you? The other keywords that will give you the word same like research. Write the word experiment, write the word study. So maybe in the text they will say it will allow professionals to conduct a study. Okay. They may use the word evidence. They may use the word findings. They may use the word record, okay, valuable record. Okay, now what are your keywords from the second option, option B?
On the person and the
Mhm.
conditions. Focusing
Focusing
on
on the
someone
person.
as an individual.
So your focus is focusing on persons as an individual rather than on the
Of
condition.
the
So
condition.
you focus more on the first part of the question, not on the second part of the question, this part. Because the second part might be a trap, like you see a condition and you feel like condition is the right answer. What about the next one?
Rather than
Addressing
addressing
issues,
issues
yes, shared
shared by
by
many patients.
many patients.
An
Next about,
individual.
so this is your focus is here, because these are the things making every option different from one to each other. So one is allowing medical professionals about a research. Second is focusing on person as an individual. Next is addressing issues shared by many patients. And next is about producing most
Producing the
rapid
most
improvements in
improvement in
patients with
mental health.
mental health issues. So after underlining your keywords, now you will first scan for the question keyword biopsychosocial. Go back to the passage. So your first answer was in the first paragraph. Next answer should be in the next paragraph. So first you will see your question keyword by biopsychosocial approach. It means it is given here. Now what was the question keyword? Question keyword, not the option. The question keyword was benefit, right? The question keyword was benefit. Look here. So if you go back, you have seen this that it has been used for both its effectiveness. So effectiveness looks like it's what? It, it looks like a benefit, right? So it effective as if you read till here, it is giving you some information, but it's not telling anything related to research. Now let's match it with the research part. Is it matching to research? First, you read the text by yourself and skim complete, okay? So don't only, although I found my word in this paragraph, it doesn't mean that I will focus only on the information that is given after that. This information can be even before that. This word gives a signal that my answer is in this paragraph, but it doesn't mean my answer is in this line. That is also a common mistake, that when you see a word, you're trying to search the information after that, and sometimes the information is given before the text. So if you see while patients individual, now you see the word, some trap words here, that individual word was written in the text as well. In the question, you remember there was the word individual also written something. Play a significant role. So when you look for the word significant role, you may feel like benefit word is written there. Yeah. Then they said it will also share several common psychological reactions such as the stress. You read, skim complete by yourself, okay? Skim this paragraph and tell me what is your understanding for overall passage. Not only that line. Focus on the word consequently also. This is about a significant role is also like a benefit.
Yes, that's the time.
You skimmed already? Let me show you the
Yes.
answers now. Okay. Now, based on your understanding, what do you say is the right answer? जी बच्चा बस थोड़ी सी रह गई है मेरा बच्चा थोड़ी सी रह गई है बस
We will also share the problems in second paragraph, the significant role in the course of the condition. They will sh- also share. So the C is the answer.
C is the answer. Then why did you say B? Earlier you said about, earlier your answer was B.
C. Because
So
here
this,
also the person stated also the individual person
yeah.
rather than
So, okay.
condition.
So Kamal, you understood what's wrong with you? That
Mm,
you match words to words. Even in the previous question, if you analyze your mistakes, even in the previous question, starting from passage 1, part A, you
mm,
started matching words to words. That is a common mistake that you are doing. That you have seen the word dressing here and you have seen the word dressing there, you matched the section. Likewise, if I take you back to the previous questions here, like this question was also wrong because you have seen some information about the family members. So what you need to do is that remember that same words are trap words. You should
mm.
not be trapped by those words that are written in the, this is your today's lesson. Because what I understand from your overall test is you have matched the options only based on because you have seen some similar words written there, meaning you focus on distractors. It's very important to know what's wrong with the text or what's wrong with me. So your problem is you are easily distracted by the information that is similar or the words that are given similar. Okay, you understood your mistakes, Kamal? Did you also
Yes, yes.
notice that now when you will revise your test, you will notice that in every test your mistake was just because there was one that you misunderstood the question, that you only highlighted the question keyword without knowing what to find. For example, you found disclose distress information, but you did not focus on what staff must avoid. And then secondly, when you are selecting the answer, you are selecting answer based on the words that are written in the option and in the text. The right words. Okay, can I proceed? This was the review of what you have done yesterday. I want you to revise the test, not the complete one, but only wherever you are wrong. Just rectify your mistakes. If you said answer is B, now don't read why B is not right because that was your first understanding. Forget about B. If the answer is C, now prove C is the right answer. Then only you will understand what is wrong with me. What was the thing that I missed last time? Did I match words to words? Or did I understood the question or I didn't understood the question earlier? Okay. Now in part C, some questions are, part C is not easy. It will take more time. In part C, some questions are based on the information. Okay, we'll talk about part C where you had more mistakes because that was the challenging question. So as you see, some questions are about the information related to the text. Some questions are about writer's opinion. This is writer opinion, right? So some questions are related to what is the I just want to clear your concept. What is the main essence of the questions? That some questions are related to opinion, some questions are related to facts, right? Some questions are related to facts, and some questions are related to the words, vocabulary, or a phrase like this. Okay, some questions are related to attitudes. You see the question? So you have the questions about fact, you have the question about opinion. Look at these things. Every question is talking about either the attitude, or it's about the opinion, or it's about the fact, or it's about the words. Right? Fact. Some questions in section 3 will be based on the fact. Some questions are based on opinions, some and attitudes. Okay, so I will give you some vocabulary that is used for opinions and attitudes. And some questions are not some. One question you may find for the vocabulary part where they give you a phrase and then they will ask you, what does it mean by this? Okay, so let me share another screen with you for my slides. Okay, this is where we left yesterday. So I said you, when the question will be about a fact, you will understand. Just now you notice the question was about highlights, isn't it? Did you notice that now the question that we read was about highlight? The question high. So when the question is about highlight, it means it's about fact. When the question is about suggests, believes, it means it's about attitude and opinion. When it is the study found, then it means this language is used to explain you the fact. When they say according to the writer, then it means this information will be about attitude and opinion. And these are the common words. You noticed your first question was done with this word only, significance. Word was written in the text, benefit word was written in the question, right? So likewise, these are the words that will give you a signal of your answer in the same passage or in the same information. These are some adjectives, and you can note these words with you. So when you see these words in the question, you try to find out the words in the text. Now, can you identify the attitude and opinion from this text? What are the words that gives you the same impressions like opinions? Hmm? Hmm?
Suggest
Okay,
and
where
the
is the word?
attitude.
Where is the word suggest? Let's do like this. You're reading, skimming from front to the last, right? From the beginning. So you have the word anger or disbelief. That is basically an attitude of the people, right? Hmm? Next one, turbo about people. The next one, stigma.
yeah,
And you see, uh, Dar said,
yeah, yeah.
okay. Then what else? According to, right? Fear and shame. What else? Prohibitively effective, not very effective. Okay. You skim it and try to identify the opinions. Okay. Later I'll show you the passage and the question. So this is how your highlighting was done. Okay. Can you make a screenshot of this text first? Find language for attitude and opinion. Done?
Yeah.
Okay. Now this is how your complete question along with the text. So here they said in the third paragraph, the question, before reading this, in the third paragraph, Dr. Rajadar suggests that, so it means the question is about opinion, right? Suggests that the wealthier residents, so what is his opinion about rich people? What is his opinion about rich people? Those are their investment. So what did he say? Now you read all the highlights. Okay. He says that around 70% of his TB patients are middle class, are affluent. What does it mean by affluent? Rich professionals. Many of many of whom react with what? Anger, disbelief when they hear about diagnosis. So there is a far greater taboo between people in affluent class saying that. So it means this all information is about rich class. They have TB. Dar said it's like having a leprosy years ago. The stigma associated with TB, yes, hard to diagnose. That
Shame, embarrassed, tears and shame as well. So
so
it can be
they didn't say
embarrassing.
yeah, so they didn't say anything about minimizing the risk.
No, no.
Okay. They didn't say anything about okay, now you see the trap word aggressive and
Yeah,
anger
this
looks
anger is,
same, but it's
yeah,
not they can suffer more aggressive from the forms of TB. Although the
yeah,
word anger is written there, but it doesn't mean that they can suffer more. They said anger or disbelief when they hear about this diagnosis. So it's
yeah.
about hearing disbelief and anger. It's not about they can suffer more. There is no information about suffering more. And then will receive better medical care. They didn't compare the medical care of the poor residents to the wealthier residents. It's all about what he said, means what was his opinion. His opinion was about their actions. How do they react? They react with anger, they react with disbelief, they feel like it's something very, very bad. It seemed like having leprosy in the past years, and this stigma contributes to this. Everything is related to what their embarrassment. There is no information about the minimizing of risks. Anger, they used the word, but not the information that they can suffer more. And there is no comparison of poor to the rich. So that's why only B is the right answer. Okay. So this is how you are answering the question of attitude and opinion. Now, next one is, this is the one I told you yesterday. I'll give you some new links to practice. Okay. So what are the things you should consider further to this? That answer in the text, refer back when you find the information. You see, first, when I have highlighted all the options, gone to the question, coming back to the text again, but not to read everything, only focusing on the keywords that are matching with embarrassment. So never rely on what you can remember. You focus on the specific detail, especially when it is a word related. Okay. And if the text discusses limited access to healthcare in rural areas, you might infer the meaning about author's beliefs. More resources are needed in these areas. So some questions may require you to infer the meaning or understand implications rather than you explicit the statements. So you need to understand the meaning. How you will skim, you will quickly understand the topic, the main idea, the structure before you are tackling to the question. You will just look at the title, and if any subtitles are given, look at the first sentence that will only give you an idea about how to cover this, and then you will identify any concluding remarks are given there. So no need to read everything. Like you are reading a title, let's say the passage is about the role of technology enhancing enhancing patient care. The introduction paragraph will discuss maybe about the healthcare setting, particularly in patients monitoring and diagnosis. It will tell you about advancement in telemedicine. It may talk about challenges in implementation and future prospects, and then you directly skim the conclusion part. Okay. And focus on these words. Now talking about vocabulary and language, that when you see the contrasting words like however, this is also an alarming point, Kamal, that sometimes half of the statement beside the answer, but after the same statement you will see they mention the word however, or on the other hand, or despite this, and then another counterpoint is given there. But you have already decided the information by reading half. When you are selecting multiple choice question, let's say you read till here and you decided it was matching with A, but after that they have used the word however, that was a counter point of the previous one, and maybe the option is C. So when you see such language, it means you should not jump to the conclusion. You need to be alert that your answer might be after these words. So in a text you read, telemedicine has significantly reduced patient wait times. However, now you see there is a counter word that signals the author is about to discuss a drawback of it. So maybe the previous question, you have seen three options. One was giving a positive impression, one is giving a negative statement, one is giving a mixed statement, and one is giving something else. So you decided only by looking at the positive part of it, you did not look for the negative part of it. So when you see such language, you need to be careful. And also, when you are understanding writers' tones and attitude, they may use the adjectives that I have given you earlier, the list. They may use the adverbs, and there can be other adverbs or adjectives as well. So they may say it's, for example, they may say it's a remarkable progress. They may say alarming trend. You focus on the language and tone they are using. Okay, if this is the sentence, try to identify the tone. Read the sentence.
Once the implication on its diagnosis, its promising historical address the appetite elements its ways, such as data privacy concerns.
So when he said, it is crucial to address ethical dilemmas it rises. So the writer is cautious and concerned about ethical implications. Despite recognizing the benefits, he is cautious. So a question might ask you, what is author's attitude towards AI in diagnosis? So the correct answer could be something that is related to author's um, concern. It can be cautiously, optimistic, concerned. These type of words should be there in the options given. Okay, A, B, C, or D. So part C often includes unfamiliar words. This is about the words now. That you see some words that are unfamiliar to you or maybe specialized for specific subject. Okay. Okay. So you need to how you will understand the meaning of a word that is not familiar to you. You need to understand this text wise. Right? For example, you see this sentence. Just suppose this is given in the text. Okay. Now I'm talking about how to know the meaning of peculiar word or unfamiliar word that you find in OET, and you are supposed to give the meaning of it. So the question may say you, what does it mean? Let's say you see this sentence, ubiquitous. So when they say the ubiquitous presence of mobile devices in hospitals have streamlined communication among healthcare professionals. So what does it mean by ubiquitous? So this word might be new for you, but based on the context that is given, what can you, what meaning can you find out from this word? It only gives you common, the expression of common are everywhere. So when you see the common presence of mobile, you just focus on presence of mobile is what? Mobile devices in a hospital. It looks like it's common. It looks like everywhere. So you don't worry about the word that is common. You try to identify text wise. Okay. So when you answer the question, as I said earlier, compare the options. Be careful for the words. Something same words given in the options and the text, but they are not always the right answer. So if your question is according to the text, so it's not about according to the writer. According to the text, what is a potential risk associated with medicine?
Your voice is very low now.
Hmm?
Your voice is very low, not clear.
Is it okay now?
Yeah, yeah.
Okay. So when you're reading the question, you can understand that this is not according to the writer, but this is according to the text. So some fact information is given. What is a potential risk associated with telemedicine? So this information is about a fact. This question is about a fact. So first you need to find out in which paragraph they have discussed about the telemedicine and the risk about it, and then you will choose the option that reflects what is given in the text rather than what is said by the people or the author or writer. So as I said you earlier, first you need to identify whether I'm searching a fact. So if fact information is given, then you won't say that what they suggest, then you just only focus on highlights, the study revealed, like these type of words. But if it is about the opinions, they will say according to the writer, or they may say he thinks or he suggests, like this. Okay, these are some other recommended reading links for you. You can go to Nursing Times, British Medical Journal, and Medical News Today. Here you will find some text that is similar to your section C. Then you will understand overall meaning. This time your focus is on overall meaning. Okay, not only the words. So I'll send you another test, Kamal. But before trying the new test, I want you to rectify your mistakes from the previous test, then only move to the next one. Otherwise, simply practicing the new tests will not work till the time you don't understand your mistakes. So learn from your mistakes, analyze them, rectify them, then only you will improve. Okay? Okay, Kamal. So that's all for today.